Now, when we talk about function, we are talking about function in the human body. It's a lungs, liver, whatever organs you take. Any particular device you take, it calculates the function of a particular organ. But what does function mean? Function means that it is responding to some stimuli. So there is some stimuli to which the organ responds. Similarly, every cell, every cell in the universe, every cell in the body is formed of the Pancha Mahabhuta, the five elements. So this is one of the biggest and important finding, that these five elements are responsible for all the types of problems what we are talking today, whether it is psychological or physiological, or it is related with the growth factors and limited problems what we are facing today. These are the five elements which are responsible. They are not only the source of our cells, they are also the stimulants of the cell, which means every cell tissue is formed by these five elements. And they are also influenced by these five elements. To make it very simple, we react to seasons, we react to outside temperature, humidity, and they are the part of these five elements which are affecting our body, which are trying to make corrections from within the body. So they are not only the source, they are also the stimulants. They are also bringing about continuous and dynamic changes within our body. So these five elements are outside our body and also inside the body. So outside the body, we usually call them by the name as air, atmosphere, we say humidity, we say electromagnetic field, etc., which influences these five elements. Inside the body also, we have the same five elements, which is functional, which is making lot of changes. So different science, different subjects, when you talk about homeopathy, when you talk about Ayurveda, when you talk about meridian system, they all are concentrating towards these five elements function within the body. So let's look into that. The wood, fire, earth, metal, and water, with the combination, with a particular combination, they form different organs. And every organ has all the five elements, but few of them are dominant. For example, if you take the blood, small intestines, heart, all the five elements are present, but the fire element is dominant in it. That's why we say that the blood related or small intestine related or heart related problems are usually connected with the fire, the Agni. Similarly, the lung and large intestine has all the five elements, but it's dominant in the metal or air element. So that's why you get all types of, symptoms which are connected with air and large intestine. One of the most important findings in Bio-Well. If you open, you have all right from appendix till the rectum. You have around 6 to 7 readings, what you get of large intestine. So much of importance to colons. And that is because you will come to know why it is very, very important to understand the function of large intestine, right? What do we mean? Every organ is formed by all the five elements, but some of them are dominant. That's why they have a particular property. So when you get into actual living, we call it as living Ayurveda, which means living with understanding of these five elements. And what is the dynamic thing which we do every day? We eat our breakfast, we eat our lunch, we take our dinner, isn't it? And these ingredients which goes inside the body are having effect on all of these elements. So they become the source of stimuli. Now, the three doshas. You talk about the three doshas in Ayurveda. In Ayurveda, there is no name of a disease. It's only permutation, combination of these three doshas. We call them as Vata, Pitta, and Kapha. Right? Now, Understanding this particular doshas is in two stages. One, when you're born, of course, it is these particular elements which have formed these cells and tissues. So obviously, you will have a particular formation of your tridosha. You will have a vata, pitta, and kapha. Accordingly, we call this as constitution of the body. That's your property. That's the body's property. But what we are actually talking about and what we are going to measure is not the property of the body, but we are going to measure the deviations from these norms, deviations from how it was before. And this is called as vikruti. It's called as changes in this vata, pitta, and kapha. But let's get into a little bit deeper into it. This is a relationship between 5 elements and 3 basic energies within our body. Please understand kapha dosha. It's very easy to understand where all you can have kapha dosha. Kapha dosha means it is a potential energy. Consider it to be having a potential energy. Like, for example, let's assume that there is excessive mucus formation. You may get into sinusitis. So sinus mucus formation is there. There is something which is sticky. There is something which is stagnant, which is not moving, which is stuck at a place. This is because of kapha dosha, increased kapha dosha. And if you see the composition is of the earth element with the water element. Without water, there is nothing in this world which can stick, which can bind, because water has a binding energy. It has a very binding energy. We usually in biology, when you're making slides, we use it as a separating medium. But here in biology, inside the body, it is a binding agent. It binds. You can eat any type of sticky food. It will never stick to your oral cavity because of the presence of saliva, which is water. But the same water is required for the formation of binding and sometimes the energy storage within our system. Liver converts glucose to glycogen. It's a storage. And what is required for that? It's a binding energy which is required because it is a anabolic changes. Now, the second element which we are going to talk is very important is thermal energy. It is nothing but fire. What is fire? Fire is transformation. Anything, if it has to convert from one form to another form in the body, you require fire. For example, you are attending a lecture now, you're listening. This lecture what you're listening, the sound waves has to get converted and transformed into material in the brain. So this transformation you require to have pitta. That is the fire element which is very much required. Similarly, body cannot be stagnant in one place. It requires movements, micro movements, macro movements within the body. And this we consider as a kinetic energy, the movement of a hand, the movement of the joints, all the fingers, all the micro movements, what's happening, circulation of blood. Blood has to move from one place to another. So it's the vata dosha. Every movement is connected with the vata dosha and the elements are air and space. Right? Now, this is how the constitution happens within the body. Now, when you look into this, when we actually look into these, we see that the vata dosha is with air and ether. According to traditional Chinese medicine, the air element controls lungs and large intestine meridian. The space element controls liver and gallbladder meridian. The pitta is with fire, dominant fire. And dominant fire is with heart meridian, small intestine meridian, pericardium, and triple warmer. And the kapha is with water and earth element. So water, you all know UB, urinary bladder and kidney meridian. And the earth element is with stomach and spleen meridian. Now, what came to our understanding was, in Bio-Well, we are getting the readings of all of these. All of these meridians, we were able to get the readings. We were able to get the energy readings. Now, when you're able to get the energy readings of these meridians, which are connected to individual organs and also their pathways, their subsequent actions, functions. This is in TCM, which we all know. But what about this, which is in Ayurveda? According to Ayurveda, it's the same thing, but put in different names, different combinations. So when you talk about the doshas, the doshas are the same five elements, combination of the same five elements, which are constituted even for your meridians. Same thing. So we already have the details for our meridians. So we were trying to find out how these details can be converted. And if we can achieve at a particular level where we can find out the deviations according to Ayurveda. Similarly, you see the connection with the sun, moon, and air. It's a very important factor where we go in for diagnosis in Ayurveda. Obviously, the same Tridosha concept, origin, it also gives you the same path. But of course, it gives in Sanskrit, so but it's all the same. But what exactly do we mean by Vata? What exactly do we mean by Pitta or Kapha? If you come to the sense organs of the body, the sense organs, you see, every element, earth, water, fire, air, and ether, they have a sense connected to that and the communication organ connected to that. It is fixed. Similarly, in Ayurveda, for every dosha, you will have the sense as well as the communication organ, which is connected. Now, simple examples would be like earth element. It is connected with the sense of smell, olfactory. The communication organ is nose. And obviously, the reaction, what is going to happen is with the earth element. Similarly, water element, fire element, air element, and ether. Now, when you, the same slide, I think, yeah, it's the same slide combined, both the slides have combined. So now the question comes, how are these doshas detected? In Ayurveda, we have what is called as pulse diagnosis. Pulse diagnosis doesn't mean that you're going to only see what is the rate and whether it is rhythmic or non-rhythmic. So we are going to make a complete pulse diagnosis. But there is a challenge. The pulse diagnosis, if you can all observe, is done with the tip of the finger. And why tip of the finger? As Bio-Well practitioners, we very well understand the importance of tip of finger. It's the highest sensitive part in the body. It's connected with the brain. So a very specialized, experienced Ayurvedic Pandit can hold the pulse and he can definitely tell which particular organ is affected or meridian is affected. But for that, the biggest prefix what is required is he should be very experienced to do this. And also it could be subjective. Look at this. When you do a proper Nadi Pariksha, we can get the measure of individual health. It can identify the risks of upcoming diseases, which is very, very important for us to understand. As a therapist, we are not for treatment. We are not for therapy. We are to find out the weaknesses in the body and try to help the patients in such a way that the symptoms are not happening or his problems are getting alleviated before, even before it is in the symptomatic stage. And this gives an idea of health status. HS factor, if you see in the area diagram, we all have the health status, right? And health status is whether you're in a healthy state, sub-health region, or you're sick, we'll come to know about it. And this is very, very important, identifying the dosha imbalances, which means that particular dosha has deviated from the norm. And it can diagnose in Nadi Pariksha, plenty of problems, which is connected with, and there is no name of a disease in Ayurveda. It's only the combination of Vata, Pitta, Kapha. So this is what happens. Whenever we do a pulse diagnosis, you see, the three fingers of yours, the index finger, middle finger, and the ring finger, are placed at the nadi, radial artery, and then it analyzes several patterns, like what is the pulse rate? How is it? Is it faster, slower? We call this as Sarpagati. Sarpagati means something which is moving like a snake. Mandukagati means something like a frog, it jumps. And Pitta dosha, most of the people will have this Pitta problems. So you can, if you just hold the nadi, you will see that you will feel the nadi prominently in your middle finger, very prominent. And Hamsa is something, Hamsa means swan, very silent, very difficult to hold this nadi, very difficult to feel this nadi. But you need a little bit of expertise, but you all can definitely hold it and you can definitely feel the pulsation at the radial artery. But there is only few formula which is used in Ayurveda. And this is the most important formula which we use. Pakvashaya kati sakti shrotasya sparshanindriyam sthanam vatasya tatrapi pakwadhanam visheshatah. What does that mean? It means that these are the organs what you're seeing there. Pakvashaya means colon. Colon is the most important organ. Large intestines are the most important organ where the Vata dosha starts. So this is why colons are very, very important. We give a lot of prominence in our therapy whenever we talk about the joint pains, low back pains, yeah, lumbagos, colons are very much considered. Similarly, hips, lower limbs, ears, bones, skin, all these areas are Vata dosha sthana. And colons are in detail. I can say in detail, they are studied in Bio-Well. So you can get appendix, blind gut, ascending colon, transverse colon, descending colon, sigmoid, and rectum. All the parts of colons are collected, the data is collected in Bio-Well. Further, when you come to the Pitta dosha is again sites of Pitta, if you see, Nabhiramashayah, umbilicus, stomach, sweat, blood, blood plasma, eyes, and again skin. Sometimes you may have rashes on the skin. So when you can have rashes on the skin, usually it is connected with the Pitta dosha. So Pitta dosha sthanas are very much fixed in the body. And then you have Kapha dosha, same thing. Uraha means chest, Kantashiraha, throat. Yeah. Then joints, plasma, adipose tissue, nose, tongue, and all of these values we already have in Bio-Well. Apart from this, we definitely have the combinations of meridian values. What did we do? We used Bio-Well, and in Bio-Well, every finger corresponds, the sectors of the fingers are corresponding to individual organs according to Sujat. Yes, we have, look at that, appendix, ascending colon, transverse colon, descending colon, sigmoid, rectum, prostate, every reading we have. And by that, what you can do is we started to add these particular details. I am very much thankful to Dimitri for this, that he initially did a fantastic JavaScript, which we ran with Bio-Well. And we were able to find out the deviations in dosha. But just by our theory, it is not sufficient. It needs to be, correlated with one of the most important and certified equipment which is available. It's called as Nadi Pariksha, Nadi Tarangini. So we purchased this equipment and we started correlating the data from Bio-Well and Nadi Tarangini. Let me tell you, Nadi Tarangini is one of the most widely used equipment by Ayurvedic pundits in not only in India, but also in abroad. And this device is the authentic and certified device for measuring Nadi. Now, the biggest advantage here is that what I told about the experience part of it to get the details is not required. So we were able to get all the details from the Nadi. And obviously, this equipment, what we did a Bio-Well reading, and at the same time, we took the Nadi Pariksha reading, both taken together at the same time. And then we correlated the results, what we got from Bio-Well to Nadi. Let me just quickly show you some examples of that. Oh, sorry, I required that. Okay, I'll probably should have logged in anyway. So we have a cloud-based system in Nadi. So we can immediately log in and get the details of our patients. So here we go. Sorry, but great. I think we are in. Yeah. And hopefully you're able to see we have a huge data list with us, but because of the time constraint, I'll be going with a few cases. Let us take up one of the case. Now, as I told you, this is a very specialized application and software meant for our doshas, meant for our tri-dosha recording through Nadi Pariksha. So when you do the Nadi Pariksha, you see Nadis are recorded, the Vata, Pitta, Kapha is recorded. And finally, with the AI, artificial intelligence, which is built in the application, it's going to give me the particular dosha for the patient. And at this particular setting, you can see it is at Vata, dominant Pitta. That is, Vata dominant is what we are seeing here. 30% increase in Sarpagati at the Vata location is the major cause of changes or deviation in this particular patient. And because of that, there are plenty of changes what you can get in the body. But what I'm concentrating is at what is the reading what I've got. It's a Vata dosha. Now, immediately before doing this, I had already taken a Bio-Well reading of this particular patient. Right? So just to correlate things, it should be theory should match the practicals. So if I can get back to this patient here, and let me take the timing, the date 7/6/2024. So here. So as you can see, we have the readings taken. It's same Bio-Well readings. And now we have a calculations which was done. And then we have the dosha tab. And in the dosha tab, we have taken 3 readings here. On 7/6, 3 readings were taken. And we have, you can see the Vata deviation being the first highest one. And we can correlate this deviation. Of course, there is a kapha deviation as well. But in all the 3, if you see, we have the increased Vata deviations. And this, when we correlated with Nadi system, with our Nadi Tarangini, and when we did the multiple scans of this particular patient, we were able to get inside of this particular Vata. Kapha is something which is difficult to analyze with the Nadi Tarangini. It's very important because it's very feeble pulse what you're going to get. So you see the quality of pulse here for Vata. It's a beautiful pulse what you've got. For Pitta, you got a very good pulse, but look at the Kapha. The pulse is feeble. So you need to really press the sensor to do that. That's why what we do is we usually do not consider the Kapha because as long as the pulse is correct. So accordingly, when we have taken multiple records, we see that the major deviations will be taken with Vata. So Nadi gave us this reading. So what did we do? The energies of Doshasthana, we added and we made 3 columns now. Vata, Pitta, and Kapha. and which were converted into, this was the earlier script what we had. So every readings what we took, how much of deviation it has happened from the norm. And then the maximum deviation we took it as primary Vikruti, or usually we consider the primary Vikruti in our therapies. So 31.3% when we say Vata. So obviously it is the highest deviation what you're able to look into. Now, most important than all, we have been looking right from yesterday about right from Dimitri's session. We have been talking about the timing. Yeah, we have been talking about the timing of individual meridians. And Dr. Neto gave us the dental part of it. We had one more, the dental part of it. With the same comparison of the meridians and the particular Vata, Kapha, and Pitta duration, which is given in accordance with Ayurveda, right? We were able to modify this chart, and this became our fundamental diagnostic chart in the clinic. This chart is more than sufficient for me to understand which meridian is affected, and if that meridian is affected, which dosha could be affected in the patient, right? Similarly, with the dental chart, we were able to get the deviations and obviously connected with the Ayurvedic principles here. Now, only one thing what I want to add is yesterday, Dimitri made it very clear that, every meridian is active at a given point of time, right? Whether it is here or here. When you take the lung meridian, it's the same. They are active at a given point of time, but at that particular point of time, some meridians and organs will be weaker. So usually it's a simple table which we take and we get a diagonally opposite meridian which is weak. So if this is active, this is going to be weaker. So accordingly, if you see, both are coming under the same dosha. So ultimately, this connection, what we have of doshas, is very, very important. Both lung and UB, though UB belongs to water element, but at 3 a.m. to 5 a.m., it is under the influence of Vata dosha. So that's how we are going to analyze this particular chart, and we can make a lot of concrete inferences depending on the readings what we have got. Then the most important concept is of the ahar, of the food, the diet, what the patient should take. Now, this is again connected with your doshas. So if you're able to get the deviations in the doshas as per the program, and when you're able to calculate these deviations, and then you can have a balanced diet, of course, to control these deviations. It's very simple. Fire can be extinguished with water. So obviously, if fire element is affected, you are supposed to work with the water element. Air can be softened with water. So if vata is affected, you have to work with the kapha. So that's why always remember, majority of the cases we just solve by the diet. The first and foremost ingredient or change what we do to the patient is diet control, whatever type of therapy you take. The reason is it alters the doshas. And here we have the permutation combination again of what to lower and increase the doshas, vata, pitta, kapha. This comes only if you know which dosha is affected. If vata dosha is highly affected, then you make change in your food which brings down this vata dosha. If pitta seems to be higher, you make the change in your food where the pitta can come down. Similarly, multiple combinations are provided in Ayurveda, and these combinations can definitely give us a very, very interesting results, especially when we are giving the solution. So when the solution comes into picture, the first thing what you are going to change is the diet, and that will be with effect with Vata, Pitta, and Kapha. And as of now, till date in Bio-Well, we have studied around 165 patients with Bio-Well and Nadi Tarangini correlation. And we are able to get, comparison result with the Vata and Pitta, considering the Vata and Pitta of nearly around 93%. 93% of the cases, we have got the correlation from Nadi Tarangini and the Bio-Well reading. So definitely the program doshas, what is being constituted here in Bio-Well is going to give us not only the information about the elements, its effect, connected organs, and also its imbalances, the results, which is going to be very useful for us as a practitioners, for Ayurvedic practitioners to just by, if you are able to get these details within few minutes, or you can find out the doshas changing. Now, one very important thing what we need to understand is your energy parameters may change. The energy parameters may change. Like, for example, if you see this scan is not similar to this scan, and this scan is not similar to this scan, right? But let's look at the yin yang. You see, this is the meridian picture. No much deviation, no much changes in the meridian picture. Similarly, if you come to doshas, you will not have much variations in doshas. Not much variation. The pattern will remain the same, though the energy picture may change. Right? Now, fundamentally, in our practice, what we are doing is we are taking the Bio-Well scan of the patient, and obviously, we are considering the dosha element. We are trying to find out the dosha element, and biggest advantage what we are going to have with Bio-Well now is this report can be sent to an Ayurvedic doctor or a pandit for further reference. It can be sent for, obviously, for further reference. Now, coming to the correlation, that's fantastic. Now, after that, what? So I am a Guasa therapist, and I do all my therapies in Guasa. I have 700 students across the globe, and they perform Guasa. And this term Guasa seems to be a bit, very ancient. It's the oldest therapy, what I can say. It's one of the ancient therapies. And why I am bringing this topic here now? Because in Guasa, we are going to work on one of the most important organs of the body, the skin, directly on the skin. And yesterday we had a beautiful presentation on photonic water, right? The water photons, how it comes. Dr. Gururaj has introduced something called as easy water, exclusion zone water, which every one of us can prepare in our house. And this is also equipment which does that. So there is no therapy which can, start without water. Water is prime. And with either you take a photon water or you take a hydronium water. This is called as H3O plus. Additional hydrogen atom will be there in the core water. So it's a proton water. It's a hydronium ion, what is present. So according to Gururaj KG, this easy water, exclusion zone water gives a fundamental hydration in the body. So hydration is very, very important, especially when you talk about doshas. When you talk about doshas, remember that 85 to 90% of the problems or diseases is because of vata dosha, the dryness in the body. And this, I am not saying, this has been told by eminent Ayurvedic pundits. So you have to, if you are able to detect the vata dosha deviation in Bio-Well, please address it at importance. It's very, very important. And addressing it is very simple, improving the hydration, drinking water. Now, I would like to introduce Swami Shivananda. He is from India. Now, what is so special about this gentleman? Yep. This gentleman, if you see his passport, Yeah, his date of birth dates way back 1896. And till date, he's alive. He's a yoga guru, oldest yoga guru in the world, and 128 years. We were just looking at the presentation given by one of our colleagues with results with mice. Yeah, he is on planet Earth. And this individual, because of his services, he was also presented with, okay, this in Kannada. I'm just reading out for you. His age when the slide was formed was 125, and he never wears specs. Kannada ka hakala means he never wears specs. No medicine taken till date. Never been to a hospital. He doesn't know what a hospital is. He has never been to a hospital. And he is a yoga guru. He does yoga. And remember, yoga breaks the vata in the body. And because it frees all your joints. And this individual has been provided with Padma Shri Award by our Honorable President of India. And you see, 128 years. Right? And what does he say? He's saying, eat the liquid and drink the solid. Means you should drink water sip by sip, like how you eat the food. And the food should be chewed so much that it becomes liquid in the mouth and you can gulp it down. That's a secret. And there are plenty of interviews of this gentleman in YouTube. If you're interested, you can go through that. But what am I showing you? I'm showing you that water can do miracles. And I have also sought for an appointment to take a Bio-Well scan of this individual. And I will be presenting the Bio-Well scan shortly once I have it of this person. It's very difficult to meet this person. He has become you can say a VVIP in India now. Very difficult to sort for an appointment as well. But his teachings are very good. His secrets are drink water. So that's the secret of any therapy, right? Now, any therapy, any problem in the body, any deviation in the body will give us a symptom. And the symptom is pain. Yeah, the symptom is pain. And you have to reduce the pain. How do you do that? And of course, pain is to protect us so that you don't overuse the particular area and damage it further. So it's for the protection. The information goes to the brain for the protection part of it. But you know what? Of course, detection is something which you can always do it with Bio-Well, and it can be connected with your doshas, and you know which dosha is affected. Pain can be there for because of deviation of any of the doshas, Vata, Pitta, or Kapha. Remember, if you have a Vata dosha problem, you will have pain in the joints. The movement will be affected. Mobility will be affected. If you have Pitta related problem, you will have pain in the form of fire, burning pain. Some people say, isn't it? My feet, under the feet, it is burning. I have a burning sensation. It's because of Pitta. Wherever you have burning sensation, it's connected with the Pitta dosha. And there is some problems people face because of some knots formation from some fibrosis, yeah, formation of fibrosis. All this is kapha related problems. But the solution is very, very interesting. So in the solution, as you all know, we have 4+1 pillars of healthy living. This 4 pillar we all understand: endocrine system, gut system, autonomic nervous system, emotion and stress. But majority of us do not follow the 5th pillar. And Bio-Well gives us a tremendous opportunity to do that. Dimitri has also made a program for that, and that is understanding the geopathic stress. You all can use your Sputnik. I have shown majority of them that with Sputnik, you can measure, get the activity level of environment or space, and it is equally important in healthy living. If you're living in an area with geopathic stress, your doshas are affected, seriously affected, and because of which there can be symptoms in the body. Of course, it's all connected with the five elements again. The same picture will come. Now, according to Ayurveda, we have chronology of problems. Obviously, it's a six step. I have mixed the third step there. So biochemistry and physiology, it's combined. So mindset, psycho-emotional state, emotions or lifestyle, and symptoms. Symptomatic stage is when the patient comes to you. Before that, nobody will come. Yeah. And in the symptomatic stage, if you do not take care, it goes into disease stage. Obviously, as a solution, majority of them initially they will start, surrender themselves to medicines. Not required, please. Water, hydration is the best policy, best thing in pains. And then you move. That's what we say, even in Rig Veda, which is the oldest available scientific proof, the Vedas. In the Rig Veda, you can cross check Mandala 10 and Sukta 9. It's called as Apasuktam. Apo Ishtamayo Bhava. It's a very, very famous hymn. And it gives the importance of water in the body. So my therapy, Guasa, starts with water. And obviously, I concentrate on the Vata dosha in the joints, all the joints. Obviously, you may think that in Bio-Well, it is difficult to find out which area or which joint is affected because no joints names are given there. Remember that when you're talking about the lower back, the nearest joint is the hip joint. When you're talking about the chest area, the nearest joint is the shoulder joint, right? So when you're talking about the meridians, the lung meridian, the large intestine meridian, one of the most major causes of tennis elbow nowadays. So it's your elbow joint. We know that every joint is important for mobility and they're connected with the Vata dosha. So you have a deviation in Vata, get ready that there's some joints which is going to face the problems. So we do not give any medicines. We ask the patient to be well hydrated and then diet control as per the dosha what we get. And then we do Guasa. Guasa is a simple therapy. It's a very simple therapy. Like this is acupuncture, you see on the top, cupping you see below. Similarly, to acupuncture on cupping, you have another therapy which is termed as Guasa. It's a very simple therapy which is done on the skin, on the skin. And remember, to do this particular therapy, you're required to have no prior medical knowledge. It is not required. You don't need to depend on any professionals. The patient can do it on his own. And of course, it is done outside the body. Nothing to do with inside body. But the results are proven with zero side effects as of date. Our foundation till date has crossed more than 16,000 cases just in doing Guasa. And my students across, they perform this Guasa and it gives us tremendous amount of results. Psycho-emotional balance as well as physiological balance. I will also show you the effect of Guasa in Bio-Well, right? So what all can be treated? Almost all the Vata related problems like pain and stiffness, neck related spondylitis, etc. Back problems, very important nowadays. And majority of people have this. Leg pain, including numbness. Systemic diseases, yes. We are taking care of type 2, please. Type 2 diabetes and hypertension, varicose veins. And of course, it can be used as a general massage and beauty guasa is for beautification part of it. But quickly, let's look at the advantages of this. It's very easy to learn. Absolutely no scientific textbooks are required for this. Zero side effects. And the biggest point, the diagnosis and the treatment are done together. I'll show you how it is achievable. And you can do it wherever you want. Very, very quick results. Within 10 minutes, your body can show the results. of the therapy. What exactly happens in Guasa is there is increased circulation, vasodilatation, increased circulation of blood, and once the blood reaches the cells, affected cells, the body starts healing on its own. There is no much additional part required here. Guasa board and oil, what we are going to use for this particular purpose. Only one thing what you need to understand is the directions in which you're going to move the board on the skin, right? I will also try to show you some treatment videos, okay? So shortly, I'll just play the treatment videos. Here you see, this is done, it can be done on the head region. So whenever you feel, you take a Bio-Well reading and you find that the head region is having some deviated results, immediately do the Guasa, and after 10 minutes, you take the Bio-Well again. And you will be able to see the changes immediately, especially with the lower back, especially with the neck and the lower back. Always use the top to down movements because that is the reason, that is the way, that is the direction of energy flow in the yang channels, which are dominant in the back of the body. Yang channels are connected with Vata and they are responsible for majority of your problems, especially in the back. In the back, you have UB channel, urinary bladder meridian, which is connected with all the associated points in the body. Now, you do this for the respiratory system in the chest area and for the knee. It's all just top to down movement by using the board. What you do. One thing what you have to keep in mind is whenever you have a problem or a congestion, obstruction to the flow of blood, energy in the area, blockage in the area, the affected area becomes red in color. We call this as a petechiae. It is an indication that this particular region is having a problem, having some changes within the body system. So I think I jumped few, yeah, right? So Guasa is a very simple therapy, but what effect does it show in Bio-Well, right? Let me show you some cases. And yesterday, we saw Dimitri being showing one beautiful case. There is nothing wrong in this. I don't find any deviation in energy. I don't find any breaks in this energy parameter. 50 joules of energy for a female is good. When I come to yin yang, yes, I see some weaknesses in few of the meridians there. But the most important tab, if you see the fingers, beautiful emissions, no cuts, no deviations, no undercuts anywhere. But the very important tab which we have to look forward is the balance tab. Look at the balance. Cardiovascular system moving towards the parasympathetic stimulation. Its heart rate is coming down. So what happens? Oxygen supply to the body, to the peripheries will be reduced. So the patient will start feeling fatigue, though he has recorded a very good energy. There will be fatigueness seen in this patient. Lack of interest. Look how many bars are towards parasympathetic, which means it's pulling, it's bringing back the body towards rest. And now please look at the timing, 5:36. The scan was taken at 5:36. And 5:36, as you know, yeah, it is the kidney meridian, which is going to be active. And the opposite to kidney is large intestine meridian, which is going to be weaker. So Vata dosha has taken the effect. So we did the Guasa to these points. Point number 1, point number 2, cardiovascular system, heart, very important places. The points are fixed in the body. So we do the Guasa. After doing Guasa, you have to allow the body to respond. Many of us, when we want to take the records, what we do is we do the therapy, immediately we take the post therapy results. It's not going to give you much changes because the body has to respond. And in Guasa, the response time is 10 minutes. So minimum 10 minutes you have to leave. And after that, you can rest the patient. And then the readings were taken. And look at this. With almost the same energy, what happened to balance? It's beautifully balanced. Furthermore, the liver became more active. Here, you see, there is a sympathetic stimulation in the liver. So what does that mean? It means that majority of the weakness, I'm not telling that the energy, I've improved the energy. You can still see that some energy is lower. Like for example, number 3, the colon is still weak. And it's a weak time. It was a weak time. But the imbalances have been corrected. So what does Guasa do? Guasa removes the imbalances. And this imbalances, I compare the yin yang before, and after Guasa. You look at that. There is a distribution of energy. Imbalances have been corrected. And furthermore, most important, the symptomatic change in the patient. The patient was more active. And, unfortunately, the patient had a lot of interest to do work at that particular time. I was able to analyze this particular patient's activities, right? But this is how Guasa can bring about a lot of changes. I have a directory of studies which I have done, especially with several case studies which we have done. And in all of them, we find that Guasa gives a tremendous amount of balance in the energy circulation of the body. And finally, definitely, I would like to also show you some of the videos of the therapies, how it is done, a very quick review of the video. It's all present in YouTube. You can always go through that. You see, I just fast forward so that we don't waste much time. You see, it's a simple movement. Hopefully, you're able to see. Yes, I think, please confirm. I'm not able to understand. Are you able to
Yes,
see?
yes, we can see the video.
Yes, good. So you see, it's a simple movement of what is being done on the skin. But because you're doing it on the skin to reduce the friction, you have to use oil. Because if oil is not there, it will be more friction will be there. There could be tissue damage, which is not what we want. And this oil should also have some essential oils in it so that, you know, the redness, what you're able to see there in I'll just forward it so that you can see the redness. Can you see this red part which is happening? That's the weakness. That's the weakness which the patient is having, and this oil is going to prevent secondary infections in the area, right? So you can work on spinal cord, you can work on the scapula, and you can work on the small intestine point, SI11 point, very important point. It gives you tremendous amount of result. Apart from this, if you're somewhere outside, it's not possible to do it on the skin. You can just use the board on the clothing for immediate relief. You get almost instant relief whenever you have any stiffness in the area. So this individual had a neck problem. So these treatments, therapies are my camps where I conduct. They're available in YouTube in my channel. So you all can look into the multiple therapies. I've demonstrated almost all the therapies in my channel here. So you can, for a knee problem or any type of problems, you can look into the videos. Okay. And so Vasa is helpful. And obviously, I am thankful to Dimitri for giving me another opportunity to speak about the doshas. And I am very much thankful for his all the works, the software part of it, what he has done to compile and give us a visual appearance of Vata, Pitta, and Kapha, which has been correlated with Nadi Tarangini, one of the certified devices, and it has been seen that in my clinical practice, this particular tab is going to play an important role. Thank you very much again for giving me the opportunity.